I'm Dr. Daniel Kantor, Neurology in Real Time, and I'm so happy to be joined here by Karyn Bishof, who is a COVID long hauler. Many of you back home might be thinking, what's a COVID long hauler? We've heard of COVID-19, but what is a long hauler? Karyn, thank you so much for joining us, but can you tell us a little bit about that name?
Sure. Thank you for having me. So basically, in the beginning of the pandemic, we were expecting a 2-week cold or flu-like illness. Long haulers, so those like myself, started to find out that they were sicker longer. They were waiting for that 2-week mark, that month-long mark, the 2-month mark, and we weren't getting better. So in short, long haulers are those who did not recover in the time that was initially anticipated. So I consider a long hauler anybody who's been experiencing COVID-like symptoms and illness for at least a month post-COVID infection.
So what you're describing is that you were expecting there to be an acute illness, and then you thought you would either recover, or there's unfortunate people who don't recover. What you weren't expecting, and many people like you weren't expecting, was there to be a long-term sequela. And so we call that kind of sort of a sequela or chronic illness after the SARS-CoV-2 infection. Why were
Exactly.
you so surprised by that? Did your doctors not explain this to you? Was it not in the media?
So exactly. So it wasn't in the media. And really, when everything was coming out of China in the beginning, we weren't hearing anything really about long-term effects. And I think the obvious thing with this is that to know if there's long-term effects, you have to give it time. So unfortunately, we're kind of like the guinea pigs of those who got it early on in the pandemic. I came down with COVID in the middle of March, and here I am 8 months later, still having issues. So, looking back at research, even with SARS in the past, we knew that there were long term effects from that. So, it kind of bothers me and it baffles me a little why we didn't have any suspicions that that might be the case for COVID 19.
Who came up with the term long hauler?
Actually, Amy Watson, who is the founder of one of the other Facebook groups, COVID Long Haul Fighters, she actually coined the term and it just kind of took off.
Okay, okay. So this really seems like a grassroots sort of thing that's going on. It seems like people like you, just regular people, were infected by the virus, expected that they'd probably get better because you're young and otherwise healthy and maybe not so many comorbidities. And then suddenly you're found, oh my God, I now have a chronic illness. This isn't what you were expecting.
No, it's not what I was expecting at all. And we know with some other illnesses, you kind of get a, post-viral lingering effect, but something to last 8 months is not normal. That's not your typical 6-week post-viral kind of illness that you hear about. Um, Many of us thought, what's going on with us is just that COVID is like still active in our bodies somehow. Like we have no idea. We were trying to figure it out. And a lot of the information that the medical research world is coming across is actually learning from the patient. They really wouldn't be getting into the right hands. So I'm super proud of those like myself who are being advocates, who are doing this type of research and pushing it out, and not even just pushing it out to the media about COVID-19, but highlighting the other chronic illnesses that COVID has triggered. So things like dysautonomia, things like autoimmune disease, chronic fatigue syndrome. So I'm in contact with several of these other organizations trying to collaborate on both research, and they're kind of helping us in return trying to figure out how we can fight for medical coding and more funding for research and how to get the word out. So from other chronic illness communities, seeing all of us, they feel for us because we are a very, very large influx of chronic illness patients. And that is something that is going to inundate the medical system on top of what we're dealing with acute infections. So that's something that's going to be very complicated. And I think that that's why we also continue to struggle to find care, because all of these doctors are just inundated by the current acute everyday infections from COVID-19.
Have you found that doctors don't seem informed about the long haul or the chronic illnesses that can be triggered by COVID-19?
Absolutely. I think that's probably our biggest struggle. In the beginning, even now, I was going to doctors. I had a pulmonologist tell me, well, I have a heart attack patient and a COPD patient that are fine. So there's no reason that you're not fine. Just
Mhm.
give it time, it'll go away. And that did not rub well with me.
Right.
And almost every doctor that everybody was going to, oh, it's anxiety or it's psychosomatic. And that's not the case.
No.
And for a lot of us have developed dysautonomia. I mean, the study that I did said 1 in 3 were developing dysautonomia and 1 in 5 were developing
Yeah, and
autoimmune disease.
let me stop you. Just for people back home, they're hearing this term dysautonomia. For some people, they may have it, not know that they have it, or they may never have heard of this term. Just to explain to people, dysautonomia, dys is like bad. In medicine, we use Greek and Latin, so it means it's not working right. Autonomia is the autonomic nervous system. People are pretty familiar with the motor nervous system, with the central nervous system, and with the peripheral nervous system. You know, the central nervous system is the brain, the cervical spine, the thoracic spinal cord. And then all your nerves, like when you think about diabetic neuropathy, that's your peripheral nervous system. There's a much bigger part of the nervous system that people don't talk about a lot, and doctors understand a lot less than they understand both the central and the peripheral. And that's the autonomic nervous system. That's the idea of flight or fright. That's the idea of, something's happening to you, or your pupils going to change, they're going to get bigger, they get smaller. Is your blood pressure going to drop when you stand up? All these sorts of things, that's your autonomic nervous system. And your autonomic nervous system has developed over time. And we're not going to get into the issue of creationism versus evolution, but the autonomic nervous system is really there to make sure that you can help yourself with both sudden threats as well as what do you do when you don't have those threats. And so, for example, if you were a caveman and you're being chased by a lion, well, you don't need to stop and go to the bathroom. You actually need constipation at that point. And so when your sympathetic drive is going on, when you're scared, you're less likely to go to the restroom. When you're not having that, it's the opposite. And so we think about the sympathetic and the parasympathetic, it's the yin and yang of the autonomic nervous system. When somebody has dysautonomia, and that can be caused by COVID-19, it can be caused by many other conditions. And unfortunately, because it's hard for people to see, it's hard for other people, it's hard for your family members to really believe what's happening. It's hard for people to relate to it. It's hard for your doctors, like they can see if somebody's walking with a limp. They can see if somebody's arm is cut off. But if somebody's saying, well, I'm having these weird things where I have these sweats that I don't understand, I'm having like almost like palpitations, my heart is racing. These are things that people can't see. But you know what? You come to the right place, Karyn, because you know who does handle these things?
Oh,
Neurologists.
yeah.
Neurologists. The field of neurology has both the opportunity as well as the obligation to take care of COVID-19 long haulers. We are very, very well trained in how to handle these exact sorts of symptoms. And whether it's caused by a virus called SARS-CoV-2 or by a virus called Epstein-Barr or a virus called, it doesn't matter. It doesn't matter what causes it, these symptoms end up being about the same. And we've actually, over time, developed great ways of treating them. They're not just medications. We use really a multimodality approach. The idea is both education, as well as actually doing physical occupational therapy, as well as doing things like acupuncture, holistic things. The idea is really to look at the person as a whole. The field of neurology, I will argue, and I'm saying this as the president emeritus of the Florida Society of Neurology, and as a person who's very involved nationally with neurology, we have an obligation to step in here. There are emergency room doctors, they can handle when you're having lung problems during a COVID-19 infection. You have other doctors who can handle what's going on in the hospital. But neurologists, we are the doctors of chronic illness. And whether you're describing COVID-19 long haulers or whether you're describing somebody with multiple sclerosis, frankly, the symptoms are very similar. The reason actually I first heard about you was probably one of your media appearances, but then actually reading things, what you were talking about on Facebook was exactly the same things that I am on lots of Facebook groups with my patients with multiple sclerosis. If you didn't actually look at the title, the group could have been the multiple sclerosis page. It didn't have to be the COVID-19 long haulers. And so I actually think from a scientific point of view, there's a couple of things that are going on. One is that the virus, when you have it, causes damage. Some of that damage is permanent. Yeah. And that damage can be in the autonomic nervous system. Other parts of it, it's not that the damage is permanent, it's that your body then attacks the virus. And your body gets confused. Instead of attacking the virus, your body starts attacking yourself. When that happens in your joints, we call that rheumatoid arthritis. When that happens on your skin, we call that psoriasis. When that happens in the nervous system, in the central nervous system around the nerves, in the oligodendrocytes, we call that multiple sclerosis. When that happens due to a virus called SARS-CoV-2, we call that COVID-19 long hauler, for the lack of a better term. Yep. We are seeing autoimmune diagnoses that are happening from your response to the virus. And what I want to remind some of our viewers, and a lot of them are physicians, is that we have an opportunity now. You know, none of us were alive, obviously, when the first person who we think had multiple sclerosis back in the 1300s. When neurology was born in the 1800s and they first described multiple sclerosis, there was no social media. We had no ways of really thinking about grassroots. When polio happened and we started having the post-polio syndrome, once again, it was early on in this last century. We didn't have the opportunity. We are right now in front of us watching a new diagnosis happen, and we're watching patients organize. And those of us who have been involved in patient advocacy have a duty to help you guys, because you weren't in healthcare before this, unless you want to call what you're doing. You weren't like taking care of people on a day-to-day basis. You weren't familiar, I don't think, with support groups and what does it mean to, what are the issues that we have to deal with in terms of Medicare, Medicaid, and private insurance? What do we have to deal with in advocating in Tallahassee and in Washington, D.C. and in Capitals Cross? You've had to teach yourself this. We've been dealing with this for a long time. In fact, 15 years ago now, but almost 16 years ago, we started a group right here in Florida called the Florida Neuro Alliance. And the basic idea of that was legislators said, stop coming to us and talking about 200,000 people with this, 1 million people with that, 250,000 with this. Come together, you have common issues, accessibility, American with Disabilities Act, stigma. I'm sure the stigma, we haven't gotten into that, but I'm sure stigma is a big issue here. Why don't you come together? And so California started that 2 years before us. About 15 to 16 years ago now, Florida at the same time as Washington State started a Neuro Alliance. And I've got to tell you, people, doesn't matter what their diagnoses are, they are amazing with it. People, and you'll notice I use the word people, not the word patients, but people with whatever diagnosis, their loved ones, we call them care partners, not caregivers, because you're not an invalid, you don't need a caregiver, you have a care partner. You have someone in your life who's there with you, who will support you and you'll support them. You may have COVID-19 long haul now, your spouse or a significant other may have heart disease tomorrow. You have to find a support system. The people who are sometimes obstructing this idea are actually the not-for-profits. The not-for-profits are dedicated around a specific square. This is their disease. So I am very impressed that you've been able to make those alliances with some of the smaller nonprofits that deal with dysautonomia or with other sorts of symptoms. Because oftentimes they're very territorial. They say, well, we handle asthma. We handle epilepsy. We don't want to hear about what's going on with the rest of the things. The doctors, we're the same doctors. We take care of everyone, no matter what the diagnosis they have. People don't care what diagnosis they have. They just want to get better. And we've talked to legislators. We actually started this back when Marco Rubio was in the House. He was in the Florida House at the time. And so back in those days, I think governor at the time, it was either Charlie Crist, may have been Jeb Bush actually, at the time that we're doing it. We have great connections with Senator Aaron Bean. And what you learn is that healthcare is much more local. You see things on the news, they talk about national campaigns. The truth is, healthcare is right here. It's in your local county, it's in your local state. And that's where we need to work together. So when you're looking at all this, what are the things that the struggles you've had? It sounds like you've kind of overcome a lot of them in terms of the system, but what are the ones that you've noticed? Like, tell me more about the stigma that might come with having COVID-19.
Well, to go back to like what we were talking about initially in the beginning, it was anxiety, anxiety, anxiety. So nobody was recognizing that there were prolonged issues from COVID-19. So you had to overcome a doctor dismissing you in the beginning, either telling you just give it more time, you'll be fine, or telling you you had anxiety and wanting to write you a script for anxiety. Then it came to the point where all we were hearing on the news was about COVID infections and death rate or recovery rate. And to speak on recovery rate, that's one of the things that we highly disagree with, because the recovery rate that you see on your TV screen every day is simply the number of people who had COVID, who no longer test positive, and who didn't pass away. But if you ask a long hauler if they're recovered,
it's a
they're
very
going
low
to tell you
bar.
no.
That's a very low bar for recovery, right? You're not
Exactly.
dead, basically. That's all they're saying.
No. So we want to get the point across that, like, no, we're not recovered. And I think when you have a recovery rate that's showing that high on TV and that's not accurate, that's leading to the dismissal from the general public on how serious COVID-19 can be. So they're saying, oh, well, only, this percent dies and all this percent lives. Well, I want to talk about, I constantly say, I survived COVID-19, but I'm not living. I have lost significant quality of life as have other long haulers. So when you see that recovery number on TV, please don't let that fool you. And I encourage people to join some of these long hauler groups and search it up on Google and read some of these people's stories. This is not something that you want to have. So in terms of trying to advocate for ourselves, people are dealing with their hospital bills. And while a lot of insurance companies have come out and said, we'll cover COVID-19 hospital stays, we're finding that they're only covering hospital stays while you are positive for COVID-19.
Are you
So if
serious?
you are a long hauler who ends up back in the hospital for a variety of reasons, or you're going to all of these doctors for your long haul issues, they are not being covered by the insurance companies.
So what happens if you test positive, but then you're hospitalized for 3 weeks, but at 2 weeks you no longer test positive? Are they covering that last week, or even that?
I think if you're initially hospitalized and you don't leave, I think that that's being covered. I'm talking about you're released from the hospital and you end up going back for an episode of syncope or tachycardia or whatever the case may be, other infections that we're getting post-COVID and
all your
surgery.
All your healthcare needs, basically.
All your healthcare needs.
What
So
have you noticed in the street? Like, do people look at you differently because you've had COVID or you're a long hauler? Do they not want to, they put masks on around you more than they do around other people? Or
I mean, that's kind of like a mixed response. So, the general public, like if they know you and they know you had COVID, you might have people that are very curious because it doesn't make sense to them how you could still be sick. But then you have people who will cross the street to avoid you, or neighbors who will maybe forego an invite to you for something. Granted, we should not be going anywhere in gatherings, right? But you have these things, even family members, going back to the mental health aspect, who just don't comprehend how somebody can be sick this long. And I don't know if that has to do with personal beliefs or it's just emotional for them to see somebody they love sick for so long that they're still in denial. But it's been very hard on people's relationships with their significant other, their children, their family, their friends,
Have you heard of
and
divorces? Have you heard of divorces in long haulers?
yeah, so there's part of one of the studies that I did was kind of to evaluate like how this is affecting people's relationships. And one of the questions was, have you broken up or filed for divorce or officially divorced because of your health issues? And there were a good amount of answers that said yes. And one of the questions I asked was, do you feel COVID-19 in the future and your health issues from COVID-19 is going to cause your relationship to end? And that also had a good amount of people who answered yes. So it's putting a huge strain on not only the patients, but as you said, their caretakers as well, or their family, or whoever is helping them out. And a lot of that has to do with just feeling horrible all the time. But many long haulers are no longer able to work. So there's the stress of being sick, there's the financial stress, there's the stress of not being able to take care of the kids in the same level that you used to be able to care for them. So it's just one thing that piles on another, that piles on another. And we know for patient recovery, stress is a horrible thing. So that just continues to add to the stress and possibly the inflammation and fatigue that these patients are experiencing. And the same thing can be said for physicians. Um, as you know, if anybody's been to a doctor lately, any doctor's appointment you have has a whole screening process. Have you had a fever lately? Have you had a cough? Have you been short of breath? Have you experienced diarrhea,
And you tested
constipation?
positive for COVID-19.
How does a long hauler pass that screen? So we're constantly having to tell doctors, I'm a long hauler. I've been dealing with this for 5, 6, 7, 8 months. Some doctors won't see you because you're checking off symptoms on their screening list. Some doctors are making patients continue to go get COVID tests or prove that they're negative or that they have antibodies and so on and so forth. So the complications to getting support both from physicians and your friends and family or the general public are definitely strained, and it's not helping um, us find care or get support.
What's your estimate on the percentage of people who survived SARS-CoV-2 infection who then become a long hauler?
So a couple months ago, Dr. Fauci came out and he said that he estimated about 1 in 3 who were not hospitalized become a long hauler. And we know that really the majority, I would say about 90% of long haulers were never hospitalized.
Right.
So we're looking at millions, at least. So I did something the other day for um, the Twitter page, and I was trying to make a point on how many people were still suffering from COVID and about the whole recovery rate. This is not the accurate recovery rate. So it ended up being, I think I did 11 million cases, which is about what we were at when I did this, minus the death rate. And with 1/3 becoming long haulers, we were at almost 3.5 million long haulers just in the
Mhm.
United States alone. And then
Right.
if you take that and divide it by 3 again for the estimated 1 in 3 developing dysautonomia, we're well over a million plus who have developed dysautonomia. And just to speak on that for a second, I know that neurology and sometimes cardiology or electrophysiologists will deal with things like POTS and other forms of dysautonomia. But when you look on Dysautonomia's website, um, Dysautonomia International's website, they have maybe 40 doctors in the whole United States who say that they specialize in dysautonomia. So in joining those groups too, I've learned how hard it is for current dysautonomia patients to
Right.
get into these doctors because it's so few and far between. What happens now to long haulers who need to see these doctors, and what does that do to the current patients?
Right.
So I think that's one of the huge things that we're kind of trying to collaborate on and discuss, because in my opinion, while we have this COVID-19, this post-COVID syndrome, this sequela, um, with the numbers that we're seeing and the lack of doctors qualified to make this diagnosis, um, I fear, and I almost am certain, that this 1 in 3 number for dysautonomia, this 1 in 5 number for autoimmune disease is actually very underestimated. And that's super unfortunate. But my fear is that these people are going to continue to go undiagnosed because there's so little physician education about this. And there really needs to be a massive awareness campaign, even with just primary physicians.
Mhm.
Because you can't keep diagnosing your patients with anxiety. Meanwhile, they're
Mhm.
dealing with hypotension, episodes, passing out. They're dealing with dizziness and vertigo and nausea and vomiting and tremors. These things can continue to get worse when untreated. And again, it just adds to that patient's stress. And personally, I think about this all the time, is at what point do we stop saying we're a COVID-19 long hauler and saying I'm a dysautonomia patient, or saying I'm an autoimmune disease patient, or saying I'm a chronic fatigue syndrome patient? And that's something that, again, needs research. It needs to be looked at. Are all of these issues COVID-19 related? Is this the sequela from COVID-19, or are we having a mesh of symptoms, or are all these symptoms now dysautonomia? So when people are saying that they're long haulers, people, maybe month 2, 3, 4, like we're still a COVID-19 long hauler. When you get to month 8, 9, 10, 11, 12, at what point do you begin to differentiate what's going on with you and what your official diagnosis is? And that's something that needs to come to the forefront.
Well, yeah, and there's so much that's involved with that aspect. With what do you call a person who has these symptoms? And a lot of it has to do with politics, frankly. A lot of it has to do with the politics of medicine. It has to do with international classification of diseases. The ICD-10, or the International Classification of Diseases.
Mhm.
I mean, we have 50,000 codes. We have codes for getting plucked by a turkey, getting scratched by a turkey, and getting bitten by. I mean, it's crazy. You could fall from a spaceship and have your left arm cut off or your right arm. There's codes for everything, but then for MS, one code. So I mean, so it just gives you an idea of, like, when people are creating these codes, it's created by people who are not thinking about patients and how do we help them. I want to tell you two things, and then I want to get a little personal. I want to hear a little bit more about how you were in, say, February of 2020. Um, Sir William Osler is the grandfather of a lot of what we do in American medicine. And in 1903, he said, the best teaching is that done by the patient himself. Now, it was 1903, so we'll forgive the latent chauvinism. He didn't say herself or themself, but that idea that the most we can learn actually is not from some textbook, and not from some website, and not even from other physicians, but we can really learn by listening to people in front of us. And without even knowing what virus it was, whether it was SARS-CoV-2, or let's just say I was asleep the whole time, I didn't know there was this new virus, what you're describing is an autoimmune response to a viral infection. What the name of the virus is doesn't matter to me, because once the virus is on your system, it doesn't matter. You are going to act the same way as somebody who was exposed to Epstein-Barr virus, or somebody exposed to any other virus. What you are describing is autoimmune responses. And we have to think about, is it a good idea to split off different names? I actually don't think so. I'm right now in the process of trying to bring together naming. And so we've been using a hashtag one mission, one community. And the idea, even just in multiple sclerosis, is now we have all these people kind of subdividing what kind of diagnosis you have. That's not helpful. That's not helpful in research funding. That's not helpful in advocacy. That's not helpful in anything except for people who are interested in the research of subdividing what type of diagnosis you have. This idea of being told, oh, you look so good. That is something we hear all the time from our patients. They walk in and people say, oh, but you look so good. I actually don't even call chronic illness. I call MS and COVID-19 long haul, I call it a lifetime diagnosis. It's not chronic or lifelong. That makes life sound long and arduous. It's lifetime. It means it's going to be affecting you. Doesn't have to always be the number one thing that's most important. You have school, work, spouses, other things going on in life, but it's there. And much like the cable station by the similar name, when you turn off your TV, you still pay cable bills. So even when you're not having a symptom, it's still there in the background. And you have to just know that it's still there and you still have to take care of it. Now, what I want to do is kind of go a little bit more personal. Like people back home haven't met you before necessarily, unless they've seen you on Dr. Phil or on one of the network television shows. What were you doing in February 2020?
I was a firefighter paramedic. I am a single mom. I worked out 5 to 6 days a week at Orange Theory, was highly involved in my son's life, playing soccer with him, taking him to soccer, and basically doing everything that a normal 30-year-old would be doing. And that drastically changed after getting COVID-19. I I find myself struggling every day just to do basic in and out of household chores. So something like going food shopping will put me out for a couple of days. Things like trying to just do the laundry and wash the bed sheets is an hour-long process because I constantly have to sit down and stop, either due to nausea, dizziness, my heart rate is just out of control. And any little thing just triggers one symptom, which triggers another, which triggers another. So it's a domino effect in everything. And I find myself most days, after only being up for an hour or two, like I need to lay back down and take another nap. And I, strangely, as tired as I am, struggle with sleep, and I have really bad insomnia to add to all of this going on. So that not only affects me, but it affects my son, which obviously I feel extremely guilty for. But there's really nothing I can do to change what's going on other than try and advocate like I am to find solutions and bring attention to the problem. I miss working out because that was a huge release for me, both mentally and physically. And then when you sit here every day and you feel horrible every day and you have no timeline or solutions, it's super hard mentally. If you have the flu, you're like, okay, maybe a rough 2 or 3 weeks and I'll be okay. You have COVID-19 or post COVID, as I call it, and nobody has an answer. Nobody knows what medication can help you. Nobody knows what imaging to have done. Nobody can tell you in a year, in 5 years, in 10 years, you'll be better. So there's no answers, and that weighs heavy on all of us. And I think that's why this grassroots movement really began, because instead of sitting here doing nothing, twiddling our thumbs, waiting for someone else to take action, I don't think that somebody who has not experienced long haul COVID really gets it fully. Obviously, doctors that have treated chronic illness, or as you call lifetime illness, they see their patients from other conditions and they get it. But like you said, learning from the patients themselves is probably the best thing that you can do. Even when it comes to research surveys and studies, you don't know what questions to ask unless you've experienced this yourself. So getting patient input on what you're really looking for and what these patients need is what's definitely going to help you as physicians and as the medical community move forward in trying to help us. So we're kind of doing our best to help you to help us.
Well, Karyn Bishof, I want to thank you so much for explaining what COVID long haul is, for describing the struggles that are going on in the community. And I can promise all of viewers back home, this will not be the last time that we hear a conversation between the two of us. And this will definitely spark the next kind of move that we do in advocacy and in research and in care and education. Those four principles, we will move forward together. And you have an ally here, and you have an ally in the Florida Society of Neurology, and you have an ally with neurologists throughout this country. Karyn, thank you so much for joining us. And everyone back home, thank you for joining us as well.
Thank you so much. Bye.